I'm Dr. Anthony Maloof at Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video edition of the Medical Merry-Go-Round. Do you feel like you've been sent from doctor to doctor to doctor and left with the feeling that you're not getting any answers? You might just be on the medical merry-go-round. Modern cars have different specialists that look after mechanics, electronics, hydraulics, etc. But biology is much more complex, so medicine breaks the body down into groups with, for example, a cardiologist who is a specialist that offers advanced heart treatments. But at some point, the heart has to work with the body and the brain and everything else, and that's where the integrator comes in to make sense of it all. And the integrator manages both the body and the mind. But medicine still doesn't have a recognised integrator. So it might be a specialist, a family doctor, or a combination. But unfortunately, lay people and now Google have become the default pseudo-medical integrator, which tends to make things worse for the patient. Poor integration can cause unhappy outcomes, and I'll discuss two scenarios. The first occurs with chronic disease. Patients search desperately for a cure, and doctors may not want to say there isn't one. So the patient ends up seeking opinion after opinion, having test after test, treatment after treatment, getting confused, depressed and unhappy, not to mention poorer. The second is a problem of incentive. Medicine's become a business that profits from putting more patients in front of more doctors more often. So, corporate medicine now comes in, with many medical arms under one roof, marketing to the patients that they can do it all, which might be true, but it does send the patient from one doctor to the next in a never-ending loop. In the USA, this practice actually has a name. It's called the Florida Shuffle. The medical merry-go-round can be confusing and detrimental. I have treated a very disillusioned patient who suffered from devastating negligent surgery whilst under corporate medicine. The complication was managed by simply referring the patient in-house from one doctor to the next, each one telling him that things were fine, but no one telling him what had actually gone wrong and why he lost his sight during surgery. If you think you're on the medical merry-go-round and want to get off, get back to basics. Ask to confirm your diagnosis. Ask for supportive evidence. Confirm whether your treatment is considered recognised for that diagnosis, and finally, pin down a date when the diagnosis can be reviewed. Thanks for watching. I'm Dr. Anthony Maloof at Eyes and Faces, Corneal and Oculoplastic Surgery in Sydney.